Welcome to McMaster Minds, a podcast brought to you by McMaster University's undergraduate psychiatry program. This podcast will explore psychiatry training and the path to getting there through honest conversations with residents and staff. We hope this gives you a sense about the life of a psychiatry resident and staff psychiatrist, and that it helps you make the decision about whether psychiatry, and hopefully McMaster, is right for you.
Today, we are joined by Dr. John Devine, a clinical associate professor in the Department of Psychiatry at McMaster University, with a cross appointment at the Department of Family Medicine. Dr. John Devine, thank you so much for joining us. To start, can you introduce yourself briefly to our listeners?
Sure. My name is John, and I'm originally from Montreal. I trained in medicine at McGill University, and I then did a family medicine residency at McGill University. I then moved to Toronto, where I did a psychiatry residency at the University of Toronto. So I am double boarded, actually. I'm boarded in both. I'm considered a fellow of the College of Family Physicians, and I'm a diplomat in the Royal College of Physicians for psychiatry. And I then, about 1981, moved to McMaster, and I've been here ever since in the Department of Psychiatry. So that's me in a nutshell.
It's a pleasure to meet you. Let's start at the beginning of your journey. When you first entered medical school, what specialties were you considering?
I remember writing a letter to McGill about where we had to talk about ourselves. And I actually remember writing, I am interested in psychiatry, but I said, I'm not sure where I'm going to end up, but that has always been, the psychological sphere has always been something of interest to me. So that really was an interest of mine even before I entered med school. And I do remember writing that in the letter to McGill. And things do evolve over time, but that was my initial interest.
Okay, and it sounds like things did evolve over time. Was there a particular rotation, mentor, or experience that led you to think that psychiatry might be the right fit for you?
I think that when I was finishing medical school at McGill and then I was applying to residencies, it became clear to me that I knew that let's say, I don't know, the heavier duty ones, surgery, internal medicine, I knew that was never really in the cards for me. For me, what I was choosing between was, I'd say it was family medicine or psychiatry or pediatrics. That's where I saw more of a place for myself. And I remember when I did pediatrics as a medical student, I kind of found it interesting, but I kind of knew that I think I wanted to work with adults. It just, no reason for that. That just became clear to me. And I will say that when I was in med school, for me, in general, when I was doing the rotations, I found that it was in fields like family medicine or psychiatry or pediatrics, I related more to the people who were teaching me and the whole sphere. Nothing against the other specialties, but I kind of saw that internal med, surgery, though those were not for me. That just became clear as I went through med school. And then it became a decision between family medicine and psychiatry. And what I was thinking at that time was, I did like parts of physical medicine that is part of family medicine, and I wasn't sure if I would miss that or how much I would miss that. And I also knew that family medicine is very much psychiatry, and even the literature says 30% of family med is psychiatry, which I would say it is. So I began thinking that maybe I could satisfy my psychiatric needs as a family doctor while still retaining doing some of the other more physical medicine stuff. So that was a decision I felt. I'm also going to be honest that, and this was about 40 years ago when I was making this decision, there was somewhat of a stigma about psychiatry. And some people, when I asked some of the people some of the mentors I was working with about where do you go, I kind of, was seen as, well, you're betraying medicine if you go into psychiatry. And there was stigma about that. And, there was messages of, I got more positive input, I think back then, into family medicine than psychiatry. And I would probably say that may have had some input. I'm never quite sure how much it has, but that may have had some impact on me. Hopefully, I think it's less stigmatized now. I don't think it's gone, but that may have played a part in the decision. And I did choose to do family medicine. I will tell you that in the first year of family medicine, some further things became clear to me. And that was, and I really respect family medicine. I work with family doctors. I think they are central to a good medical system, but it wasn't resonating in the same way for me. So things like, which is all part of family medicine, diagnosing and treating hypertension, upper respiratory tract infection, well baby care, all on and on, all important things. What I found, it wasn't my passion. And when people came in with a depression or an anxiety problem, that I really started looking forward to as I was doing my family medicine rotations. So in my first year of family medicine, even in the first 6 months, it became clear to me that my passion, and that's something always important, is what really moves you and motivates you, was doing more of the psychological slash psychiatric stuff. The other stuff in family med very important, but it wasn't my passion. So 6 months or so into my first year of family med, I then applied to psychiatry because I knew that's where I wanted to be. And I finished off family med, or sorry, that was in my second year of family med. 6 months into my second year of family med, I applied to psychiatry residency, and I got in and I finished family med, and I am boarded in family med, and then I went directly into psychiatry. It was a longitudinal, it was kind of evolving thing like that. Um, but it's worked out for me. I think I'm going to say one other thing that was personal for me is that in family medicine, you have to be comfortable with some uncertainty. So in other words, you're learning things a little more superficially, but very broadly. Jack of all trades in a way, master of none, without putting it quite that way. But I was not so comfortable with that. My style was I preferred more circumscribed knowledge in depth. So that also became a factor for me when I was doing family med. It was one, I was a little uncomfortable with the uncertainty, and I respect people that who are, but it wasn't so easy for me. And the other thing was just psychiatry and psychological stuff became very clear that that was my passion. So that's what I did. That was kind of an evolving thing for me, and that's kind of how it evolved.
No, thank you so much. It sounds like you really overcame some stigma in choosing your field. You mentioned that the interview with a person who was suffering from depression or anxiety was very meaningful for you. What was it about the work of psychiatry that really drew you in?
Yeah. And I think all I can say is just the whole psychological sphere of things and issues of, mood and personality styles and personality disorders and all the psychological aspects. But I'll tell you what I also liked about psychiatry, let's say, versus psychology, is that I do like the mind and the brain. So, just doing psychotherapy, great. But I think as a psychiatrist, having the occasion to do both psychotherapy, the mind, but also getting an understanding of neurosciences and the brain and biochemistry and medications, putting together both of those was really great for me. So it really satisfied both my that psychological interest of mine, which was coming up with knowing people and depression and anxiety disorders and personality styles, but also diagnosing psychiatric illness, having treatment plans involving medication and bio neurosciences. That also really appealed to me. So it was really a nice blend of both. And what I'll tell you, by the way, is it's funny, and I tell people this. I think it also became clear to me that even though I liked some parts of physical medicine, I knew I wasn't going to miss the one thing I missed, I'll tell you, from physical medicine, and I don't know if you've had occasion to do this was when I worked in the emergency room, sometimes you'd go to the back room and you'd stitch someone up after a cut. You'd put on the music, you'd be in the back room. It was all very pleasant. The cut looked great afterwards. Very gratifying experience. That was the one thing I really missed from when I went from family medicine to psychiatry. Again, all the other stuff is important, but it really is what your passion is about. And my passion was psychological stuff, though really with the neurosciences, the mind and the brain was really such a fit for me. So I really have never missed, like I say, just the stitching was a funny thing that I remember. Oh, that was so much fun. But the bulk of family med, it became clear to me that was not where my passion was. And I'll tell you, from my first week, I I left Montreal and I did my psychiatry residency at U of Toronto in Toronto. And that was from that first week, I tell people again that there was a little click in the back of my head, a little block fell into place, and it felt like a fit I had really never felt completely anywhere else. So there really was some kind of fit for me doing psychiatry, and it's been a great ride ever since. I've never lost that fit.
Yeah, I can really hear your passion for the field in your answers. How important was work-life balance or the lifestyle of psychiatry in the reasoning of your decision?
Yeah, what I'll tell you is I think it's a nice thing to have a work-life balance, though, whatever you choose, you can create a balance in psychiatry. I don't know that that was a factor in my decision. And what I would tell you and students is for me, it was go with your passion. And I'm going to be honest, if my passion was surgery, and if someone's passion is surgery, I would say go for it because it's so important to choose what really turns you on. You can always adjust your lifestyle once, again, not so much in residency, but afterwards you can adjust it. And I think you can make it fit you in terms of what your work-life balance will be, or at any particular stage of life. There's flexibility that we all have in whatever branch of medicine you're in. So what that was not really a factor for me, and I actually would say to me it was my passion. It just became clear it was there. And that's what I would tell any student is I would really urge you to pursue your passion, whatever it is, as you do the different parts of medicine and see where things are going, go for it, and you can really adjust it, I believe, to whatever your work-life balance you want it to be.
Sometimes students wonder how psychiatry compares to the other areas of medicine they are considering. And I think you touched on a lot of what separated psychiatry for you, and passion seems to be super important. Were there any misconceptions about psychiatry that made you hesitate at first? And if so, what helped you move past them?
Yeah, I have to tell a joke now because this is kind of one of the misconceptions about how much psychiatry does. There's a joke about what do people do in medicine, and if I remember correctly, and I may not, internal medicine know everything and do everything. Surgeons know nothing and do everything. Psychiatrists know nothing and do nothing, and pathologists know everything, but it's too late. That's a joke that comes to mind. I mean, that was the misconception is like, what does psychiatry do? And they don't do that much. To me, that's a complete misconception. I can tell you, I've been 40 years in the business. I feel completely good about the extent to which I've helped people. What I'll tell you about psychiatry is this. We still don't completely understand the brain because it's so very complex and neuroscience is advancing. We have a lot of theories, but I think in terms of what is the pathophysiology of depression or bipolar disease or anxiety disorders, we have theories, but I think today we can't say we absolutely know. It's more theoretical than knowing it. Perhaps didn't come in my career, but it might come in the next one. So, and we have theories about how our pills work, but I don't know that we know exactly how they work. It's all still being sorted out. Having said that, what you can do in today's world is we can take this constellation of symptoms and Siggy caps and low mood for a period of time. That means you have this thing we're calling depression, and then we can run RCTs on it. And I can see that this medication works for that, even if we don't know exactly how. And counseling works for that. And counseling and medication work better together than either alone. And the side effects are not that bad. So we can run all kind of RCTs on entities and see what happens. And in a way, that's the state of the art of psychiatry, in my opinion. And that's fine. And I'm good with that. And I feel I have helped oodles of people over time, and I feel very comfortable and great, actually. I feel it compares to anywhere else in medicine. And I did family medicine. I've seen what happens in other fields of medicine. And again, we don't know always the exact pathophysiology, but with where we are right now with DSM, which is what's called a phenomenologic diagnosis, we make it based on a clinical presentation. But because we have RCTs that show what we can do, I think we do